In decades gone by, cancer was considered a fatal disease. But today, a lot of common cancers can be cured if detected early. Cancer is not just one disease, but rather a group of diseases. The disease is an abnormal growth arising from one's own cells and could occur at any age and in any part of the body. However, it is not contagious or infectious. Most cancers occur in easily accessible sites on the body. As such, early detection is easy. Survival rates among breast cancer patients are climbing thanks to greater awareness, more early detection, and advances in treatment. The term breast cancer refers to a malignant tumor that has developed from cells in the breast. Usually, breast cancer either begins in the cells of the lobules, which are the milk-producing glands, or the ducts, the passages that drain milk from the lobules to the nipples. Over time, cancer cells can invade nearby healthy breast tissue and make their way into the underarm lymph nodes. If cancer cells get into the lymph nodes, they then have a pathway into other parts of the body. Only 5 to 10% of breast cancers are due to an abnormality inherited from the mother or father. While there are steps every person can take to help the body stay as healthy as possible, such as eating a balanced diet, not smoking, limiting alcohol, and exercising regularly, breast cancer is never anyone's fault. Initially, breast cancer may not cause any symptoms. A lump may be too small for you to feel or to cause any unusual changes you can notice on your own. Often, an abnormal area turns up on a screening mammogram, X-ray of the breast, which leads to further testing. In some cases, however, the first sign of breast cancer is a new lump or mass in the breast that you or your doctor can feel. A lump that is painless, hard, and has uneven edges is more likely to be cancer. But sometimes, cancers can be tender, soft, and rounded. So, it's important to have anything unusual checked by your doctor.
2002, I have been to UK along with my husband. Suddenly, I found that there was something abnormal in my right breast, which proved to be cancer. As a doctor, I never bothered about myself. I used to tell the patients that they should have the mammograms early, they must go and have a checkup. But as a patient, I felt I was least informed, I was least interested in myself, which should not be there for any woman.
Swelling of all or part of the breast, skin dimpling, constant breast pain, nipple pain or the nipple turning inward, redness, or thickening of the nipple or breast skin, bloody discharge from the nipple, a lump in the underarm area can be a symptom of breast cancer. These changes also can be signs of an infection or a cyst that are not cancerous. According to ICMR statistics, 90,000 new cases of breast cancer are registered every year in India. There are also many cases that are not reported. The multidisciplinary approach in oncological care enhanced survival in breast cancer.
I was diagnosed of breast cancer in 2007 December, but much before that, in October, when I was just going through the newspaper, I came to know about Usha Lakshmi Foundation. I got a letter from my club that saying that there is a free camp conducted by Usha Lakshmi Foundation, and I went there, and that was a blessing in disguise for me. And later I was asked to meet Dr. Raghuram. He himself called up and said, "Madam, I have to re-examine you." That minute itself, I was sure that, because the doctor can make out from the mammogram, I was sure that it is something malignant. I came, but I never looked back. I was very, very sad, but not diffident, because the modern medicine has improved a lot, and what I have seen 20 years back is different from what I am seeing for the past 10-15 years. 20 years back, I couldn't withstand seeing a lady for even a few minutes on the second day of her chemo, but now it is not so. I came to know that I can go to the college even while undergoing chemo, because my side effects were very less. I could teach even while undergoing chemo. And similarly, radiation also, I adjusted my timings. I fixed up such a time that I could go to the college and go to the radiation center and then go home. So these are the advantages with the dissemination of information which is given, which we have to have from every center. Whatever hospital that we approach, they should give us some information on this.
The most common risk factors that cannot be changed. Besides being a woman, you are at risk as you get older. If you or close blood relatives have had or have this disease, about 1 case of breast cancer in 10 is linked to changes or mutations in certain genes. Women having her menstrual periods before 12 years of age or who went through menopause after age 50 have a slightly higher risk. Women that have no children or who have their first child after 30 have higher risk. The risk factors that can be controlled. Being overweight increases the risk, especially after reaching menopause if that weight gain took place during adulthood. Exercise can lower breast cancer risk by about 60% in adults. Breastfeeding lowers breast cancer risk, especially if breastfeeding lasts 1.5 to 2 years. Alcohol is clearly linked with an increased risk of breast cancer. Long-term use of estrogens together with progesterone for the relief of menopause symptoms may slightly increase the risk of breast cancer. It is important to know your breast and be aware of any changes. If you find a lump, do not panic. 90% of breast lumps are not cancerous. Mammography is a test which examines the human breast and is used as a diagnostic and screening tool. Regular screening mammograms are the best way to detect breast cancer early, when it is easiest to treat. Many breast cancers are found by the woman herself, but the smallest cancers are found by mammograms. Additional imaging with breast ultrasound can help determine the presence of cysts, fluid-filled sacs that are not cancer. Annual mammograms should start at age 40. Clinical breast examination every year starting at age 40. The size, stage, rate of growth and other characteristics of the tumor determine the kinds of treatment. Surgical removal of the tumor provides the single largest benefit, with surgery alone being capable of producing a cure in many cases. To increase the likelihood of long-term disease-free survival, several chemotherapy regimens are commonly given in addition to surgery. Most forms of chemotherapy kill cells that are dividing rapidly anywhere in the body. Radiation may be added to kill any cancer cells in the breast that were missed by the surgery. Some breast cancers are hormone sensitive, such as estrogen and progesterone, which makes it possible to treat them by blocking the effects of these hormones. Breast cancer takes years to develop. When breast cancer is detected early, the 10-year survival rate is close to 100%. Annual screening mammogram is the key to early detection.
I was detected of breast cancer in the year 2009, and it was just as an incident that I just felt a lump in my breast, and immediately, without anybody's intervention, I visited the doctor and they referred me to Dr. Raghuram. And here when I came, I had undergone all the tests like mammogram and ultrasound, and finally there was some malignancy, and for which I had undertaken a surgery, and after then I had my chemos, and now as you can see me, I am hale and healthy. Whenever we hear of cancer, we think that it is something end of it, but this is not so. I request everybody, especially in the age group of 40, to undergo the mammogram and to detect this particular cancer in a very early stage and then save our lives, because you all know that women is the backbone of the house, and if she is not well or if she has something in her, then it is going to affect the whole family. These days cancer is curable, and I consider all the women, especially in the age group of above 40 years, to undergo regular checkup, detect as soon as possible, and so that you will be cured and your family is also secured.
Medicine is both an art and science. The art is the care and the healing, and the science is the curing. Women always seek treatment last. They wait till the son has given his exams or the daughter's marriage is conducted. But when the man of the house is ill, he is well taken care of. The favor is not always returned when the woman is ill. Women should feel empowered and not always depend on someone else. Don't let breast cancer eclipse your life. Get any breast changes checked promptly by a doctor.